You know that I've always maintained that every one of us in Nigeria, we are poor people. We are poor. Even Dangote himself, with all the fact that they call him the richest man in Africa, in this Nigeria, he's still a poor man. He will drive the same roads that are anyhow, have access to the same healthcare system. If something happens that is on his own, that, oh, God forbid bad thing, maybe there's an accident where nobody knows he's somewhere, he will have access to the same useless medical care that we have. Many people, when I see people blaming people who are jackbuying, who are leaving the country, oh, like this one, life out there, it's not that it's their suffering, but there are some basic things that, you know, whether you are rich or you are not rich, whether you are known or you are not known, the fact that you are a human being, they will take care of you. They are not even going to wait for whether you're going to bring bill or they will charge you. No, they will first of all take care of you. If they are going to charge you and then they will charge you and then you start paying later. But in Nigeria, nothing like that. You might be in a situation whereby, oh, you're just going, you have an accident. What access do you have? What kind of medical care do you have? Maybe they don't know you. Your billions in your account or your millions or your thousands in their account, at that moment, they are not going to save you. Is the kind of healthcare system that we have that is going to be your saving grace or not? And that's the thing we are talking about. Nigeria will do every one of us. We are all victims waiting to happen. And how a lot of people don't see that. I don't get it. They think that their prayers is what saves them, is the thing that will save them. They have the patent to prayers. You understand? We keep praying without doing the right, without using the brain that God has given us. You know, just see the young man that had an accident, and you know, people videoing him in the hospital where he's supposed to have care. In some places, when there's an accident or something, people are airlifted. There are air ambulances. People, they come, they will airlift. You don't need to know anybody. You don't need to be rich. You don't need to be anything, because there are healthcare systems that are there for the public. They will bring in air ambulance. They will lift you. They will be flying you. Where they are flying you to, they've already relayed to the person on that airplane. There are already paramedics and all of that. Check to what is wrong. What if it's something that you need operation immediately? As you are coming in, they are wheeling you into the theater before they even reach the hospital and drop you in the hospital. They've already prepared the theater. As soon as you come in, you are wheeled in. You go in there. They start emergency operation. At the end of the day, the person, most of them survive. But here we say is their time. The person with that, they will just treat you anyhow. Things that should be called murder, they will call them is their time. Is the person's time. Is the person's time. The people where they outside this country, their own time to die, no, they're different. I be our own people where they go access medical care and they take care of themselves. Their own time different from the rest of us. Their own time different. We are all victims waiting to happen. No, it's the one that it has done. The one that will be the next victim is there, either supporting the system or not doing anything or looking the other way, not knowing that he or she is going to be the next victim of that Nigeria. It's turn by turn Nigeria Limited. I always say to people, keep saying God forbid. The last person also said God forbid. It didn't mean that it will not happen, because God has given us brain that we have refused to use. We have everything we need to be a great nation, yet we refuse to do it. It's so heartbreaking watching this video of this young man where they were busy filming him while somebody was dying. You are busy filming him. God, Nigeria, the number of people that Nigeria. That's why during COVID-19, when our rich people could not fly outside, the rich were also dying, because they only had that access to the same healthcare system that all of us had. I remember a minister the other time, or was it on Abuja Kaduna Road, some years ago, where a minister, his wife and son, they all died in an accident. The nearest hospital that was there, they didn't have anything, nothing to treat them with, nothing. And that's why those people died. Meanwhile, this is a hospital that was set up particularly because of accident on that road, yet had nothing. In a decent country, those people most likely will still be alive today. Are we not ashamed of ourselves? Is it not time for us to get this country to work for every one of us? Let's even do it selfishly for ourselves, to say, okay, if anything ever happens to me on the road where they don't have access, they can't reach my family, they don't have access to my account, what can be done? That's the thing that all of us should be thinking about, so that when we have things that work for everybody, if we ever be in a situation where we need it, it will also work for us.